Mabona. Hi, thank you for watching this video. In this video, you will learn how to provide basic patient care at Walk in the Light Care Center. Hand washing. Hand washing is very important in order to stop the spread of infection to your patients and to yourself. You want to wash your hands before and after touching a patient, after you use the toilet, after eating, and if you touch anything dirty or contaminated. So right now, I'm going to show you how to wash your hands. First, you want to wet your hands. Make sure that the water's not too hot, not too cold, but it's better if it's warm water. Then you want to put the soap into your hands. And you want to go palm to palm, left over right, right over left. And then you want to make sure that you're applying friction in between the fingers, in the back of the fingers, on your thumbs, and you want to rinse thoroughly, making sure all the soap and the bubbles are gone. Then you want to turn off the tap with your elbow. Then dry with paper towel thoroughly. This has to be done for at least 30 seconds.
Infection. Patients may come into the hospice center with wounds. I'm going to teach you the signs and symptoms of an infected wound because patients may come into the hospice center with wounds. You're going to have to look for inflammation, redness, pain to touch, warmth, and pus formation. The wound might also have a bad odor. If any of these signs and symptoms exist in your patient, please send to the clinic immediately. Also, if the patient develops a fever or swollen lymph nodes around the neck or behind the ears, this means that the infection has spread beyond the site of the wound, and you need to take them to the clinic immediately. And make sure to tell the sister.
Patient hygiene. Patients can either be cleaned in the bed or in the shower. It is important to clean patients once a day to promote comfort and to remove any bacteria that can cause infection. To begin, please grab 4 different towels and a basin of warm water if they are in bed, or do this in the shower. To first take the first towel to clean the face from the inside of the eyes to the out. Make sure it is wet with water, but do not apply soap. Then put soap on that towel and continue to wipe the rest of the body with the arms, underarms, front, and back. Use another towel to wash the bottom half of the body and complete with the legs of front and back and the feet. Use another clean towel and wet with water and soap and clean the genitals. Then once again, grab another towel to clean the anus of the patient. Use separate towels to prevent infection. Make sure the towels are clean and the water is warm.
Patients at all times.
And please be gentle with the patients at all times.
Assessment. Daily assessment of patients is important just to see if anything is wrong with them. First, you want to look at their head. You look at their scalp and you see that the hair is healthy, and you want to check if there are any rashes. If this is so, take them to the clinic. Next, you look at their eyes. Pull down the cheek and look at the white part of the eye to see if it's yellow. If it is yellow, please take them to the clinic, and you want to do this for both eyes. Next, you want to feel for their lymph nodes. Lymph nodes usually are inflamed if it's infected, so you'll feel them like little balls. So you want to check first behind the ears and go down alongside the jaw onto the chin. And you can also check here near the clavicle. Next, you want to ask them to open their mouth. You look for something called thrush. Thrush is something that is on the tongue or on the sides of the mouth, and it'll be white. So you want to check if you see any white, thickness in the mouth. If this is so, they need to go to the clinic. Next, you look at their hands. You want to check their fingernails that they're not brittle or they're not clubbed, and that if there are white lines, that means they're locking in protein, and if there are black lines, that means there's liver failure. And you want to look at the hands, and you want to look at the muscles as well to see if there are any muscle wasting. Next, you want to check their legs. So you want to touch their calves, and you want to see if there's also any muscle wasting. This is a side effect of ARVs for the fat to disappear and go other places of the body, or just overall a loss in weight. Then you want to look at their feet. So you want to check in between the toes and on the toes to see if there are any fungal infection as well. And that's the basic assessment. Pain. It is important to check for pain during the assessment of the patient. While you're assessing the patient, make sure that you ask them if they're experiencing any pain while you're touching their body. So another thing about assessment is the skin. You want to look at the skin and make sure there are no rashes, and another thing is edema. Edema is basically swelling. Swelling can be shown by pitting, which is basically you press down and you see if the skin stays in one spot for more than a couple seconds. And you also want to look for swelling around the joints especially.
Exercises. You can exercise their neck and their arms and their hands, their legs, their feet. So let's try this one first. So you can tell the patient, you want to sit up in bed? Sit up again. Okay. So you can tell them to look down and look up.
Let's do it too.
So everybody can do it.
Look
All
down.
practice. And look
Look
up. And then you can just do circles. Circles, and then you go the other direction and do circles. So that can just, a little bit of exercise will get the blood flowing, kind of.
It'll get stiff.
Yeah.
And then it's also important to do arms. So you can just have the patient lift their arms up and bend them and keep doing that back and forth. You can go out to the side. Just simple exercises like that. And then you can have them do rotation with their hands. Do this. You can open and close the fingers.
It's ready.
Is
It's
it?
ready, yeah.
Is it break up?
Is it break? You put his arm around.
No,
Okay, he's back from the clinic. He wants to go back to bed. Are you bedding with the knees? Yeah, I gotta support him. He's wobbly.
Alright, yeah.
Swim right here. Patient turning and positioning is important to provide comfort for the patient and to prevent bed sores. First, we're going to go over how to use a draw sheet. Let's say the patient is in bed and they've fallen down too far. The draw sheet is a folded sheet underneath them. You and one other person will get on the side of the patient with the draw sheet, grab each side, and lift with your knees, not with your back, and on the count of 3, pull the patient up.
What about
Oh, first, though, we need to bend his knees so that he can help us push himself up.
Cross your arms. And put your head, your chin to your chest. There we go.
On the count of 3. 1, 2, 3. That's how. Okay. Next, we want to go over turning of the patient. We want to make sure the patient does not fall off the bed and that it is safely done. The first thing is to get the patient's arm, is to be on the side that you want to turn the patient to keep him from falling off the bed. Grab his arm and turn it over his side, then grab his leg, bend it and put it over. Put one hand on the lower back and the other hand on the shoulder. Then roll the patient over. 1, 2, 3. This is helpful to change the sheets or clean the patient, or it is a good way to position the patient. To do that, you grab a pillow and support the patient's backside. Take another pillow and put it between their legs, between their knees and their ankles to prevent bed sores. When the patient is on the side, it is important to put one pillow behind his back for support and then another pillow in between the bony prominences of the knee.